This video will cover subcutaneous panniculitic T-cell lymphoma. To anchor us, let's first notice that the main character is green to remind us of lymphoma, since lymph things are normally represented in green. And this character is wearing a taco cell t-shirt, which sounds a lot like T-cells. And of course, this is going to help us remember T-cells. To remember panniculitic, yep, you guessed it, this is a panini, which both words sound alike. And finally, to help us remember subcutaneous, just look at the subcutaneous process going on with this poor guy. Alright, let's go into the specifics now. As I've mentioned, this neoplasm presents as a superficial soft tissue mass. Microscopically, we should expect to see a proliferation of atypical lymphoid cells within the subcutaneous fat. This is represented by the fact that, well, our character here is a little chubby and he's got a bit of extra subcutaneous fat, wouldn't you say? And notice how pretty ugly looking this mass has become. This represents the fact that extensive karyorrhexis is often associated with these lymphomas, and since karyorrhexis is essentially necrosis, that's how we're going to remember this. The neoplastic cells express CD3, which is represented by this tree here, since the word tree sounds like the number 3. And since this tree is surrounded by a gate, we're going to remember positive CD8, since the number 8 sounds like the word gate. The T-cell receptor is expected to be of the alpha-beta type, and we're going to remember T-cell receptor because of this self-serve kiosk here, since kiosks are essentially receptors, right? And since it displays alpha-beta on the screen, it becomes very convenient for us. The last point to remember is that hemophagocytosis is associated with this lymphoma. To represent it, just look at his candies he's going to be snacking on soon. Don't those look just like red blood cells? Well, since he's going to be eating those soon, we're going to remember hemophagocytosis.